Start.
Hello,
Hello.
this is Dr. Gabra, the doctor in the medical admission unit. Are you Mr. Simon Gray, 29-year-old?
Yes, doctor.
Nice to meet you, Mr. Gray. Can I call you Mr. Gray?
Okay.
We are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
Okay, during our conversation, maybe I will write some notes. It will be totally confidential. Is that okay with you?
Okay, doctor.
Okay, before we proceed, can you tell me what brought you here?
Doctor, in the morning, suddenly I developed some chest pain and shortness of breath, and all came suddenly. I thought it will go away, but it was increasing rapidly. So I came to the emergency department, and after coming to the emergency department, they assessed me and they have did some X-ray, did some ECG, and they said that I have heart attack.
I'm sorry about that.
Know that why it is happened, and also they gave me some medication through my blood channel. I am feeling okay now, but I am not sure that why it happened to me. I totally lead a completely decent life, but this happened to me, so I'm little bit worried, and for the assessment they sent me here.
I'm sorry about what you are suffering, Mr. Gray. Before, can I ask you more detail about your symptom?
Okay, doctor.
So it come all of a sudden this morning, right?
Yes, doctor.
You have no similar condition before, right?
No, I was totally fine. I just
Mm,
was diagnosed with high blood pressure a week ago, and doctor started medication called Remipril, and I started the medication 3 days back.
Okay, Mr. Gray, can I know if, what you were doing when you have that attack?
I was at home, just I was getting ready for my work.
So you didn't do strenuous effort or anything.
No,
You were at rest. And can you tell me where exactly the chest pain is?
my center part of my chest.
And can you describe the pain for me?
It was severe, like crushing, and also it was like somewhat squeezing. I feel tightness, so much tightness in my chest.
Can you score the pain from 0 to 10? The 0 is no pain, 10 the maximum pain you can feel.
I would tell it is 6 or 7.
I'm sorry about that. And did you try anything helping the pain?
No,
So with rest, it doesn't you try to rest anything?
I was at rest, doctor. Actually, I was I thinking that it will go away, but it didn't go away.
And did you notice anything make it worse, like positioning or movement or
No,
anything?
nothing.
Okay. And this pain in the central, does it go anywhere?
No,
To your shoulder, your tummy, your throat, your hand,
I felt
your back,
clumsy on my left hand, but no pain.
in your
Left hand. Left hand.
left hand. Any numbness?
Yes.
And did you feel any feeling to throw up during that time?
Yes, doctor.
And did you throw up?
No.
And do you have any sweating that time or
Yes,
any
doctor.
change in the color?
That was also a symptom that I felt during that time.
Any change in color, turning
No.
to pale or
No.
yellow? And can you tell me for how long this pain continue?
This pain continued for about half an hour before I come to the emergency department, and they gave me some medication and oxygen.
And after when you start the treatment, the pain improve or?
Yes, doctor. I am feeling okay now.
And do you have idea what treatment you receive?
The doctor said that I had a heart attack. So they gave me medication for that.
Mhm. Okay, and where you stay now, in the intensive care or still in the ER?
I have been shifted to the ward.
Okay. And you said you didn't experience any pain like this before,
No.
and you have the previous history of the blood pressure only
Yes, doctor.
3 days ago, and you start treatment.
Yes.
Okay. Aside from this pain, you said you have shortness of breath.
Yes, doctor.
Can you describe it more for me, please?
That
It
also
come in the same time.
started with my chest pain.
Hmm. And goes with, so now you don't have shortness of breath.
No.
Do you have any cough along with this?
No.
Do you have any racing or pacing of your heart?
No.
Any feeling dizzy?
No.
Any pedal edema?
No.
Okay. Can you tell me if you have any significant medical history aside from the high blood pressure?
No. I was totally fine.
And, do you take any medication?
I started Remipil 3 days ago.
Otherwise, no medication?
No.
Any over-the-counter medication?
No.
I'm sorry to ask, but did you use any recreational drug?
No. Never.
Never. And do you have any allergy to any medication?
No.
Any previous admission to hospital?
No.
Any operation?
No.
Blood transfusion?
No.
Any family history of note?
No, doctor.
Any family history of heart attack?
No.
High cholesterol level?
No.
High blood sugar?
No.
Okay. Mr. Gray, can I know if you smoke?
No, doctor. I lead a very decent life. I do not smoke. I do not drink alcohol.
And you said you don't drink alcohol?
No.
Mm. Mr. Gray, can I know if you never have high body temperature?
Means fever.
Fever?
No.
Any sweating before?
No.
Uh, anyone noticed that you look pale than before?
No.
Any yellowish discoloration of your skin?
No.
Any change in the weight?
No.
And how's your appetite?
I think it is fine.
And any lump or bump in your body?
No.
The any weather preferences to hot or cold?
No.
Do you have any skin changes or skin rash?
No.
Any skin rash when you exposed to sun?
No.
Okay, Mr. Gray, I would like to ask some question about your other symptom. It seems not related, but it helped me the diagnosis. Do you have any tummy ache?
No, doctor.
Any bowel changes?
No.
Any hard stool or loose stool?
No.
Any acid feeling in your chest?
No.
Any water work problem?
Not before, doctor, but today, from the morning, it is about 10 hours. I didn't pass any water.
From 10 hours. This before you're coming to the hospital or after?
It is total about 10 hours.
Yeah, does it proceed the symptom of chest pain or before or after?
I passed my water just about 10 hours back, and then I came to the hospital, but I didn't produce any water after coming to the hospital.
Okay, and did the doctor see you regarding this complaint?
I didn't tell them. I don't think that it is a problem or not. You asked, so I am telling you.
Did they put for you a catheter through
No,
your water hole?
no,
Okay, and do you have any pain in your belotomy?
no,
Any pain in your flank?
no. 10 minutes have passed.
Okay. Do you notice any bleeding anywhere from any orifices?
No,
Any crusting in your nose?
no,
Any previous history of cough or noisy chest?
no,
Any joint pain?
no.
Uh, okay, Mr. Gray. So, can I know what do you do for living?
I work for a private company.
And any recent travel?
No.
Okay. So, Mr. Gray, can I examine you?
Okay. This is a surrogate, but you can examine.
Okay, I would like to take general inspection, general condition, if any restless, any
No,
difficulty breathing.
no,
Is he still using oxygen?
no,
Uh, any pallor or jaundice?
no.
Can I take vital sign, blood pressure, heart rate, and respiratory rate and saturation?
Blood pressure is 140 over 90. Saturation is 99%.
And heart rate?
90 beats per minute.
And temperature?
99 degree Fahrenheit.
Okay, I'll check I'll scan any skin changes anywhere in the face or hand.
No,
I'll check the heart examination, the the apex beat, any displays, not displays, the venous pressure
not
if
displaced.
increase, S1, S2, any additional sound,
No,
any murmur, any basal crepitation,
no murmur or basal capitation present.
present basal
Yes,
uh, okay, and chest examination, any problem? Chest examination?
no,
The abdomen, if any organomegaly or any aneurysm in
no,
the bedal edema, any bedal edema.
no,
I'll check the bladder if it is distended.
no,
No distension in the bladder.
no distension.
Okay. Can I know your concern, Mr. Gray?
I totally lived a decent life. Why do I have heart attack?
Mr. Gray, by talking to you and examining you, uh, you have a heart attack because of and there is no obvious risk factor, but I need to run some tests with you and refer you to specialists to rule out secondary cause like gland cause or problem in your blood channel. Sometime if you have a problem with this, can have this heart attack.
So what do you suspect, doctor?
I have many differential in my head. I need to rule out, as I told you, gland problem and vascular problem, the blood channel problem, either vasculitis or gland problem.
Okay. Do I need admission, more admission?
You need to stay at the hospital until we, we stabilize you from your heart attack and to reach diagnosis. And we, after we have the lab test and imaging, we will meet you again and inform you about the result.
Okay, doctor. Thank you.
Thank you.
Yeah, 5 minutes still. Do you want to?
I want to emphasize more if there is no crusting in the nose, there
No,
is no history of blood from the nose,
no,
epistaxis,
no,
there is no skin rash,
no,
there is no history of shortness of breath, of cough of blood,
no,
there is no history of abdominal pain,
no,
there is no history of fever,
no,
and no joint pain.
no.
Can I examine the difference between two hands, the blood pressure, and
Equal on both sides.
same both sides?
Yes.
Uh, any history of exposure to anything
Such as
that could history of exposure?
no.
I want to check the abdomen for any bruit in the kidney.
Yes, the pro is present.
There's yes. Okay. And in both sides there is bruit?
Yes.
Okay. So we need to stop the lisinopril. He take lisinopril. We need to stop the lisinopril and start on IV fluid and refer to nephrologist.
Okay. You have 1 minute more. Do you want to finish or want to continue?
Finish.
Okay. So have you reached your diagnosis?
The bilateral artery stenosis exacerbated by ACE inhibitor and maybe leading to heart attack.
Okay. So, how do you investigate him?
Patient at first, aside from basic investigation, he need imaging for the ultrasound for both kidney and imaging by CT angio to roll out bilateral stenosis of the kidney, look to the kidney size, and check renal function test, and electrolytes, and check other basic investigation like cholesterol and cardiac enzyme and liver function and renal function, and treat accordingly.
Okay. Do you think of doing any chest X-ray, echocardiogram?
Yes, sure. For the heart attack, we need to do ECG and chest X-ray and echocardiography.
Okay. Suppose this is a case of bilateral renal artery stenosis. How will you manage it?
We need to stop the S inhibitor and refer to nephrologist, give IV fluid, check for renal function test, and follow up.
Okay. So, do you know any other differential diagnosis that could be the cause of high blood pressure for this gentleman?
We need to rule out vasculitis like uh, PAN, Wagner, and other gland disease like hyperthyroidism, uh, cone disease.
Okay.
Um,
Okay. Thank you.
okay.
So, and think that any involvement of the surgeon would be necessary for this gentleman.
He may need intervention or radiology. Maybe they consider stenting.
Okay. Fine. Then I am coming to the history. Your history taking was very fine. Uh, you went for the cases. You first went for the chest pain and shortness of breath. You have excluded that, and you have diagnosed this is a case of heart attack. And after that, you went for the causes, secondary causes of hypertension. And I think you should have asked about few things more. Any changes in the facial appearances or acromegaly, changes in the hand size or shoe size.
Mm.
Okay. Any weather preferences? I cannot remember if you asked it or not.
I ask, but by chance I ask because I ask for every history,
Okay.
but I don't keep in mind the secondary hypertension.
Okay. And after that, for renal arteries, for uh, endocrine causes, you have excluded all the endocrine causes of secondary hypertension, and after that, you have excluded secondary causes of hypertension due to cardiac issue by asking any previous chest pain, any previous shortness of breath. And also, you have asked for renal cases, any problem in the water work, that was fine, and also any medication induced. I cannot remember if you have asked about any anxiety or stress in
No.
life. Okay.
Okay.
And initially, actually, you missed a little bit. I gave the clue for the diagnosis that after starting the Remiprin, the patient developed this. This is actually caused flash pulmonary edema that is due to the acute myocardial infarction, secondary to paradoxical rise in blood pressure, secondary to use of AC inhibitor in a case with renal artery stenosis. Okay.
Actually, after I finish everything, I don't reach diagnosis. After you give me more chance and more time, I search here and here.
Yes, and the cases with secondary hypertension always go for uh, that is called cardiovascular examination, and in the abdomen, along with organomegaly, always go for the renal bruit. Okay, and peripheral pulses. Sometimes premature atherosclerosis can also be present. That is impalpable peripheral pulses like this. Okay.
Mm-mm.
And you should have mentioned the urine for deep test and fundoscopy. You haven't mentioned it in the examination part. Okay. Thank you. Everything was fine. Just a few points, except those, everything was fine. And you have maintained in your time. That is, you finished initially within 14 minutes. After that, I gave you another 4 minutes. And with that, you reached your diagnosis.
Yeah, I finished the time without reaching the diagnosis.
Okay, this is not a big issue. Just whenever you cannot find any cause, then you go for the any clue that is given by the patient. Okay. There will always be a clue that this can be
Yeah,
likely cause.
it is a clue, but I couldn't solve it.